about soft tissue again. So with the first one, we're looking at the bursa sac that's right on the first metatarsal phalangeal joint. Okay, so really it sits right here in this area. By the way, test question: what is a bunion? Right there, right? Okay, good. I'm glad. I'm just making sure. All right. So that's that. All right. So, all right. If we come back and we were talking about that spring ligament, okay. Remember we were talking about the sustentaculum tali and the navicular. Okay. So we know that the navicular is going to come back off of. I'm sorry. No, that's right. I'm just making sure I get it right before I tell you wrong. Okay. So sustentaculum tali, big little bone or big bone. Right in here, okay? So the spring ligament is just right back in this area right here, okay? So you see this bone, all right, that we're talking about, and then we just drop a little bit posterior, and then we got a little soft spot, and that's where we're going to be for that spring ligament right in here, okay? So that's that. And remember, this is the deltoid ligament complex. Spring ligament just is right in this area. It's part of the deltoid ligament complex right there, okay? Posterior tibial artery. Okay, so if we're looking at posterior tibial artery, okay, again, that's going to be back here between the medial malleolus and the Achilles tendon. So we're going to be back in here with our fingers, and we're going to push right between this tendon and this medial malleolus, so right in here. Okay, there should be a little pulse right there, and everybody has, yep, there it is. Got it, it's right there on my middle finger, right here, okay? So that's going to be that posterior tib artery, okay? And of course, your deltoid ligament is the big, broad ligament that comes in here and basically attaches. It makes kind of a triangular shape right down through here. Okay. So again, if you're on the medial malleolus, you're on the deltoid ligament. That's the best way to just remember that point right there. All right. So dorsum of the foot. We're looking at the top of the foot here. Okay. So if we're going to be on the dorsum of the foot, we've got the extensor hallucis longus tendon. So if I say pick your big toe up, there it is. It pops right out. Okay, all right, if I want to see my tibialis anterior tendon, go ahead, pick your foot up again. Okay, big one right here, okay, is going to be that anterior tib, okay, right here. All right, and then the other one is the dorsal pedal. You may or may not have the dorsal pedal, okay. If it's going to be anywhere, it's going to be kind of medial lateral or middle lateral side of it, and you're just going to want to put your hand kind of right on top. So if you find the dome of the talus right here, you come just a little posterior, a little down from there, and you put your hand down, that's where you're going to find it. Again, it may or may not be there, okay? So we're just kind of looking for a general vicinity of where that may be, and if you're going to do that, okay? This one's the big one, is making sure you can get that one back here. This one, not so much, because not everybody has it, so you don't have to worry about that one too much, okay? All right. So we'll go lateral aspect, so I'll switch over to this one for everyone to see. Okay, anterior talofibular ligament, okay, most common injury in sport right here, right? This is our big one right here. So on your test there was what side of the ankle is most likely to be injured? Lateral side, okay, that's that one right there, anterior talofibular ligament. Okay. All right. You'll have to bleep that out on your videos. Sorry, people. All right. Posterior talofibular ligament, okay, is back here. So posterior talofibular ligament is going to be behind, okay. And then your calcaneofibular ligament is coming straight up and down. All right. So I think of bicycle spoke wheels. Anterior, calcaneo, posterior. It's kind of what I think of when I'm palpating those for that right there. Okay. All right. And then your peroneus brevis tendon, it's going to come in and it's going to insert on the styloid process right here, and it comes back behind your lateral malleolus. So if you just come back here behind your lateral malleolus and you're in this general area, you're on your peroneus brevis tendon right there. Okay, so that's that one right there. Okay, calcaneal aspect or back aspect, Achilles tendon is the only soft tissue we have back there. Okay, so that's the only thing we're really concerned with right there, and of course, above 30 is our athletic population that we're worried about for Achilles tendon rupture for that one right there. Okay, plantar side, bottom side, plantar fascia. Okay, so it's a big fan, so it's gonna basically originate right here, kind of on the calcaneus, and then it's gonna fan its way out to about the ball of the foot. So if you're on the bottom of the foot, you're on the plantar fascia side of things right there. All right, so again, test question, hurts the step. First couple steps in the morning, you have plantar fasciitis. Good. Okay, on that one. All right. Again, you may be asked to manually muscle test a movement. So if I say, have your athlete passively dorsiflex the foot. You would then tell the athlete to pull your toes towards you.
Passively?
Passively.
Not
I'm sorry. Actively. Excuse me. Active first. Sorry, my bad. Pull it towards you. My fault. So that would be active, okay? And then if I wanted to do it passive, I would do it. And then resistive, I would say, now pull your foot up. Okay, and that's resistive right there. Okay? So now, some people when they do a resistive, they think don't make it move, so they're like, pull your foot up. And you're like, no, we want to see it move, all right? So we want to see the strength in there, okay? Because that's going to tell us how much strength we're actually dealing with. So go ahead and say pull it up and let them do it. You just want to give them a little bit of resistance there to see that they have some strength on that, okay? So we've got dorsiflexion, okay? We've got plantar flexion coming down, okay? Inversion coming in, eversion going out, and then ab and adduction of the forefoot is just this kind of little bit of movement that we have right here, okay? So it's not going to be much on that one if we're going to do that. I'm probably not going to make you test for that. And just because that's difficult for even me to try and stabilize a joint and then test this motion right here, okay? I'm more interested in dorsiflexion, plantar flexion, inversion, eversion. Those are the big four. So if you got those down, just be careful with inversion, eversion because you don't want it to be forefoot abduction and adduction that you're getting. So make sure you get that kind of rock of the calcaneus involved in that right there.
And the
on that.
subtalar joint.
Okay, yes, very good, very good, okay? All right, special tests of the ankle, okay? Which is really good because special tests of the ankles, there are a couple that kind of mimic the knee, so it's kind of nice to have. So with our first one, just relax, right? Anterior joint test, testing the ligaments about the medial and lateral malleolus, okay? What we want to do, stabilize top hand, okay? Cup the calcaneus with our bottom hand, okay? And then what we're doing is just like you're pulling a drawer out, okay? Anteriorly, so we're just going to pull the calcaneus and keep that tibia in place. And we're just trying to slide that ankle joint, subtalar joint out towards here. Some people like to grab the forefoot and do it. I don't mind if that's easier for you. I like to do the calcaneus. I feel like I get a better test there, okay? But whatever's easier for you on that one, I'm fine. Just the real key is stabilize and pull out, okay? And then posterior drawer, same thing, stabilize. And this is why I like to do the calcaneus because it's hard to push the forefoot back in. So if I do the calcaneus, I can slide it better that way. So posterior drawer is just pushing the calcaneus back and stabilizing that tibia again on that one. Okay, inversion test, cup, turn in. Okay, that's inversion test right there. Eversion test, cup, and turn out. And that's eversion test. And again, we're just testing our ligaments, deltoid ligament for eversion. Inversion is going to be these ones right here that we talked about, and then these are kind of getting both. Interior, posterior, get both there. Okay. Foot adduction test. Again, this is going to be here, and again, if we're going to do adduction, we're kind of moving just that forefoot out. Okay. Abduction, abduction, moving the forefoot out. Adduction, we're going to be moving that forefoot in right there. Again, we're just testing right in the midfoot of the thing. We're just trying to get that ab and adduction right there for those two. Okay. Homan sign. Okay. Remember on this one, what we want to do is extend the leg out. Okay. Have them pull their toes towards you, or you can actively or passively pull their foot into dorsiflexion, and then you're going to push right in the middle of the calf muscle right there. We're just looking for pain in this situation. That would elicit pain because of the deep vein thrombosis situation that we're doing. So we're just going to take it kind of right in that middle section right there, pull and push right there is what we're looking at. Okay, so that's going to be our Homan sign. Achilles tendon, okay, is, let me see, Achilles tendon. Okay, no. Thompson's test for Achilles tendon. All right, roll over in your stomach. Okay. Thompson's test, really simple test. Again, we're testing to make sure that this Achilles tendon isn't ruptured, okay? Which on a person like this, you should be able to tell right away because this would be missing, okay? But if you wanted to test it, is you just take the calf and you squeeze and you're looking for the toes to move, okay? Kind of into slight plantar flexion is what we're doing right there. So as long as those are moving, you got it. You're good. That's it. That's that one. That's the lab number 2.